will continue. So for group 1, is everybody present?
Yeah.
Then you guys can just introduce yourself one at a time.
Okay.
Just say your name and your grade.
I'm Noni Kimani, and I'm going to grade 9. Medicare, Abolishing Copay by Kimberly Kimani, Wendy Moniki, and Samuel Wakata. What is Medicare, and what is Medicare Copay? Medicare is the federal health insurance program that accounts for citizens that are 65 and older. They also account for definite younger citizens with disabilities, and they account for those with end-stage renal disease, and it's a disease with the lungs. A copay in regards to Medicare is when a registered citizen consumes their deductible and has to start paying a 20% fee for medical service. Advocate for Medicare. We know it is a hard topic, but for those seniors who have already retired, they only have their retirement plan, so Social Security, pension, or the amount of capital they possess. That is their only source of income to pay for all of their necessities and bills. Those seniors who do work are more than likely not getting remunerated a great amount of money. I stand by maximizing the amount of money a senior citizen can have. If it is possible to reduce the amount of payments our senior citizens pay, it's better to start with Medicare copay. What are the adverses of having Medicare copay? The 20% that they would pay will differentiate according to initial costs of the medical services they had already done. It will either be a vast amount or a minor amount. Part C, which is what covers everything for Part A and B with added benefits, is needed to provide the benefits of Part A and B. And according to senior citizen Peter Widaka, he pays $150 every Monday and also pays his 20% after he visits his doctors. He also stated that hidden fees need to be advertised or put on display instead of being kept hidden. This is just a cycle of what somebody would pay after their deductible. Students at Brown University studied whether having a copay for home-based care would reduce the spending on Medicare, because previously they were spending a great amount of money on home-based Medicare. Their research conducted saw that members of both political parties feel the importance of having the copays. These people didn't look at what happens to the seniors when they have to pay the out-of-pocket costs. The copay for a year was estimated to be a max of $660, with at-home visits ranging from an extra $5 to $20 every visit. This didn't reduce spending on Medicare, it only increased. It was concluded that copay just increased out-of-pocket costs.
How can our government abolish Medicare copay? The government has plentiful ways in order to help our seniors and abolish the Medicare copay. A main area of change would be increasing the pension for seniors because of their needs and bills. By increasing their pension, it would enable them to have more freedom and space financially. The financial prowess of seniors is hard because all odds are stacked against them. On average, in the States, when you reach the age of 65 years old, the average healthcare costs $11,300 per year, per person per year. This puts the seniors in a hard situation because pensions could range from either $9,262 to $24,592, whereas medical bills alone range from $11,316 to $29,640. This puts our seniors in an awkward situation because they're almost in debt just by their medical bills alone, even though they have their own bills to pay, like electricity, water, housing, etc. past attempted advocacy abolishing Medicare copay. Throughout the years, our U.S. citizens that have obtained a part in our government have been advocating for the change of the state of Medicare. For example, on December 8, 2003, President George W. Bush put in place the Medicare Prescription Drug Improvement and Modernization Act. This act, in turn, would help our seniors by lowering the cost of their medical bills and prescription drug payments. President Bush was against the copay and tried to help our seniors to be financially stable. He concluded his statement with the following: "Today, they are just moments away from the drug coverage they desperately need and deserve." Now I'll hand it over back to Nani.
Hardships for seniors. Okay. Information below is according to R.N. Penny Matthew. It was observed that eyesight, dementia, and body are three troubles that seniors go through. Seniors who have inadequate eyesight will not have a good sense of direction. And it also puts our seniors at risk of falling or having impacts with the wall that may be severe enough to put them in a hospital. These seniors will more than likely be unable to drive themselves anywhere, even though they will have to visit an optician's office for checkups or to buy new glasses, which has you pay vision copay according to whichever plan you have. Dementia. They have bad memory, they forgot things. Their thinking processes are disturbed, and they cannot control their own money. The person who takes care of the money may be misusing it, or their family may be misusing it. They can't take care of themselves, so their kids might take advantage of them and the state they're in. Their bodies. As our senior citizens keep growing in age, their bodies are not as active as they used to. Because of their body pains they have gained over the years. It will not be easy for our seniors to bend over and put on socks like they could when they were our age, but seniors will be taking many trips to their specialized doctors to receive different prescriptions or refill their old ones, which whatever health problem they have to solve, they have, such as arthritis, diabetes, or to even get their immunizations. That would be a great copay and medical bill combined.
So what are the benefits of abolishing the Medicare copay? Seniors will not have to worry about paying 50% every time they walk into a doctor's office. Those who delay or refuse doctor checkups or appointments will discontinue that behavior. Our seniors will have a hefty amount of money saved that could have been used to pay for the Medicare copay. Low-income patients will be able to receive care without having to payment. The extra payment will also no longer discourage them from going for checkup and treatment. Incarcerated seniors who don't have a reliable source of income will be able to access treatment and save what they have for their personal needs.
Medicare statistics. As presented in the chart shown, prices are increasing greatly without having the copay involved or accounted for. The Social Security benefit is not adequate considering the amount of times our senior citizens walk into a doctor's office or have prescriptions. Also observed in this chart is the slow rise of the average of Part B and Part D out-of-pocket costs. Part B and Part D have to be paid, and then there are that are not presented up front. Policy choices. Policy choice A, we could increase taxes for non-seniors. It is legal and has been done many times in the past. It is cost effective because non-seniors won't have to pay taxes when they become seniors, and it is inclusive. Policy choice B, we can lower the housing bill. It's not illegal or legal, and it's not cost effective, so seniors will not pay a great amount of money they would pay as their property value increases. So when they sell their properties, the amount of money it would have been will not be that property value anymore. It will be greatly less. Policy choice C, increase the pension for seniors. It is legal, it has to be based on what the employers decide. It is very cost effective and it is inclusive. It will help the seniors have more of a decision with their money. You might ask yourself, what about moral hazard? Because that is one of the things that copay is put there for. Moral hazard should not be a concern for seniors because there really isn't an option for them to abuse their doctor's visits if they know they have to pay their bills. Our seniors will take benefit if the copay is removed, so they may visit their doctors and find those minor diseases they can destroy before they get too out of hand. As seniors, they should not worry excessively about their financial status because as seniors, it is one of their main reasons they worry and become stressed. Knowing the copay is removed and they can visit their doctors without paying that 20% will lift a great weight off of their shoulders. Citations and references.
Thank you for listening.
Thank you so much for a very good presentation. And now we'll go to the second group.
Yeah, they can go ahead.
Ratio deposit in the prison system. Group 2, Rachel, Grace, Lee, and Wisher.
Why is the prison system? What is the prison system? The prison system is a place used for confinement of convicted criminals. Aside from the death penalty, a sentence to prison is the harshest punishment imposed on criminals in the United States. On the federal level, imprisonment or incarceration is managed by the Federal Bureau of Prisons, an agency within the Department of Justice. How does the prison system work? Prison system is under a strict authority of the state and federal government. Offenders with less crimes, such as misdemeanors, are likely to be sentenced local jail term. It's a place where dignity, privacy, and control are given up to guards and prison administrators, where isolated and boredom can drive someone insane, and where the simplest of necessities seem like luxuries. In the United States, where more than 2 million are in prison and more than 400,000 work at them, prisons are big businesses. Why is the prison system important? Prison system is an important and integral part of the criminal justice system in every country. Used appropriately, it plays a crucial role in upholding the law by helping to ensure that alleged offenders are brought to justice and by providing a sanction for serious wrongdoing.
Examples.
Examples of racial disparities in the prison system. Racial bias. Black men are more incarcerated than white men, even though they make up less of the population. Inhuman living conditions. Overcrowding, violence, sexual abuse, and other conditions of risk to the prisoners' health and safety. Mistreatment of the prisoners based on race remains too common. How to solve racism in the prison system. First, the punishment has to be reasonable with the crime. Sentencing must be the same regardless of race. Eliminate the criminalization of poverty. Ensure fair trials and quality indigent defense, in brackets, due process. Train prison workers on how to reduce racial bias.
13 details the 13th Amendment loophole, which says that slavery is still illegal if the person has broken the law. This means that criminals, or even those falsely accused, will lose their human rights once they're put into a prison. Systemic police discrimination against people of color, specifically Black men, is well documented and shows that for Black people, we are still slaves.
The American prison system is an equivalent to slavery in many ways, but mostly. Private companies employ free labor from these prisoners in many ways, having them to make opportunities, clothing, etc. When prisoners leave the system, they still have some of their rights taken from them, like the right to vote.
Another issue with the prison system is how it's very cyclical. The American prison system is focused on punishment over rehabilitation, and it keeps generations of families in the slavery system. Many people have no choice but to commit crimes, such as stealing essentials to get by, and they can serve disproportionate sentences, especially when race is involved. An example of this is the crack cocaine boom of the 80s. It was proven that crack and powder cocaine are the same drug in different forms, but much harsher sentences were set for crack because Black people were the ones selling and using it. The prison system also affects people once they leave. There's a lot of societal stigma for being a criminal in the US, and former prisoners spend the rest of their lives paying for a crime even though their sentence is over.
Work credit. This is the end of racial department presentation.
Thank you so much to group 2. Now we'll move on to group 3.
Give me a second.
Do you want to move to the group and come back?
I'm just trying to put the presentation. It's loading. Can you put the presentation on for us? It's not working.
Can you share the presentation with me?
Yeah, let's see. Police report.
We can do the number 4 as you pulled up their presentation.
Yeah. So group number 4, you can go.
Okay. Hello, everyone. My name is Christina Swanky, and in my group is Amon, Eva, and Bridget, and our topic is women's pay rights. Since the late 1900s, women's pay rights has been a big issue in the United States. In 1963, the Equal Pay Act was passed, which summarized that no matter the gender, men and women shall be paid equally if they both had the same work. Currently, for every dollar a man gets paid, a white woman gets about 77 cents, an African American woman gets about 64 cents, and a Hispanic woman gets about 56 cents. So this slide is basically explaining that what each race of woman gets paid, like what I just said last slide.
Hi everybody, my name is Eva Gasharo. On this slide, it shows how much how much money women lose to a white man. So a white woman typically loses $13,186 in 1 year, and in 40 years they lose about $527,440. A black woman usually loses in a year about $23,540, and in about 40 years they lose $941,600. A Hispanic or Latino woman usually loses in a year about $28,036. In 40 years they lose about $1,121,440. An Asian woman usually loses in a year $6,007, and in 40 years about $240,280. American Indian or Alaska Native woman usually loses $25,884, and in a span of 40 years, $1,035,360. So why we chose this topic? Our group chose this topic because as Black immigrant women, this inequality is something that affects us. We believe that everyone should be paid based on what the job is and how long you do. It should never be determined by the gender of the person doing the work. This is something that is usually not mentioned much, but that doesn't mean that it is not happening. We need to do something about this inequality, or generations of women after us will be facing the same thing. On the bottom, we have a couple photos of women who have been involved in like the Women's Rights Acts, as Susan B. Anthony and Florence Kennedy.
Hi, my name is Ayman Adam, and we have created a solution that will be able to replace the current ineffective policies in place to gear towards equal pay, such as the Equal Pay Act of 1963. Our policy is a visual chart or handbook that will be required by law in each and every business. Every business owner will hand it out to current employees according to their rules and to people applying to work for the role, and it will show how much they will get paid per hour. If an employee sees that they're not getting paid according to how many hours they work, They will have a hotline to contact in case of unequal pay. A representative who specializes in pay inequality will aid the employee. There will be a penalty for business owners, managers, and CEOs who do not follow the law. This policy would be effective because it focuses on changing the business industry rather than focusing on changing business owners, because enforcing law would be more fruitful than bargaining for equal pay. Women's rights is a very important topic, and the solution should be through. Not, there will be 3 strikes based on how well your business is doing. For example, a wealthier company might get fined more than a new company reaping less profit. Here are the following measures will be taken. For a wealthier business, the first strike would be a fine of at least $10,000 to $20,000. The second strike would be $50,000 to $100,000, and the third strike would be license would be taken and business shut down for 1 week. For smaller businesses, the first strike would be $2,000 to $5,000. The second strike would be $7,000 to $12,000, and the third strike would be the same, where license would be taken and business would be shut down for 1 week. These amounts are hypothetical and may change according to the business situation.
Hello, my name is Bridget, and I will be talking about how this solution can be achieved. So, of course, we need to gather enough information to back up our research, and we can do this by making an online survey like a Google form to organizations, the civil society, and the government. So why are we doing this survey? Because we need to collect data and understand the trends so that we can come up with solid evidence and backup before we can present our policy to the community and civil society and the government also. Our second step would be raising awareness about the pay gap through educating members of the community through pamphlets, booklets, or manuals providing information. And we could also write articles that we could publish either on a website or a newspaper or something, so that we can raise awareness. And why do we need to raise awareness? Because we need to make people conscious about the situation, because I feel like this is something that has been going on for really long, such that it's becoming like a normal, whereas it's not. And we need to encourage people to participate in bringing change, and we can only do that through raising awareness. Third, we need to engage the civil society, because we need to identify relevant partners fighting gender and racial inequality who can contribute the expertise and resources to push for public advocacy. Because as teacher Delmeda said, there are several steps to achieve a policy, and we cannot do it just by the community campaigning or something. We need to engage people who actually deal with this on a daily basis, so that they can provide us with expertise and resources to be able to go to the next step. We also need to engage the government through, we can host an event with relevant lawmakers, like last week when we engaged with Senator Williams, because creating a policy requires constant interaction with the government, public servants, policymakers, and elected officials, because that's why we elected them in office, and that's why they hold those positions, because they need to voice our opinions. And we need to tell them what we need. So another way we can engage with the government is engaging with officials by making recommendations to Parliament and state departments tasked with conducting research about gender and racial inequality, in order to push for the enforcement of our policy to amend the existing Equal Pay Act. Because by engaging with officials, there are obviously departments that usually concentrate on this issue with gender and race. So by making recommendations, they can be able to make their research more concentrated. We could also write submissions. This is like a later stage. We could write submissions responding to proposed legislations about the pay gap in order to voice opinions about a legislation under consideration by a lawmaking body, because this is an issue that is being talked about in Congress and the Senate, and we need to do things that will push for more opinions so that the legislation can have a higher level of consideration. And now we're moving on to our references. And those are our resources and references. And thank you so much for joining us for this presentation.
Thank you so much, Group 4, for presenting. Now we'll move on back to Group 3. Are you guys ready?
Okay, sorry, I had to mute myself.
Okay, hi, my name is Joy, and this is the escalation training for police officers.
Hi, my name is Maloney, and I'm sure that a lot of you know that there's been a lot of uproar in the media lately, and a big problem that has come into light these past few months is the issue of police brutality. And not only has this been a problem today in the US, but it has been a prevalent issue dating back to the 1700s, to the first form of American policing. It's also not a secret that a lot of people of color are mostly targeted by the police, and in some situations where there's a struggle between an officer and a civilian, the outcome is sometimes fatal. There may be some instances where that's not the case, but the police shouldn't be able to pick and choose who lives or dies. A big issue in the police academy is that the job training is very underdeveloped, and it doesn't take that long to become a police officer and go out into the field and operate a firearm. There isn't enough education provided, and there's a lot of police officers going out there not knowing a lot of laws that protect civilians, and it ends up causing very stressful and dangerous situations. In a lot of states, surprisingly, de-escalation training is not required, and very few hours are spent on mediation training to help diffuse dangerous situations. You can see in the picture in the bottom right that it takes longer to become a barber than to finish the police academy, which is very astonishing. So, de-escalation training teaches officers how to slow down, create space, and use communication techniques to diffuse a potentially dangerous situation. De-escalation training provides officers with strategies to calmly deal with people who are experiencing mental and emotional crises. There are a lot of recorded incidents where police officers automatically resort to violence, which only emphasizes the point of implementing more rules and policies. Police training in the US ranges from 10 weeks to as much as 36 weeks. And police academies spend about 110 hours training the recruits on firearm skills and self-defense, but just 8 hours on conflict management and mediation. And there are only 34 states that do not require de-escalation training for all officers.
Hi, my name is Mercy. I will be telling you of the issues and what people have done. So we all know, we are all aware of the issue of George Floyd, and it has really caught the eyes of people, and people are really starting to take action. And people are taking action by changing protest, by how they protest, by signing petitions and calling and texting local government official offices and donating many different causes and spreading awareness and information all over social media. Now, this isn't just a in the US type thing, it's worldwide, and many people have brought the light to issue because they know that this has been going on for so long, and they don't want to see other people getting, just a certain group of people getting affected by it. Next slide. What government officials have done so far. So the officer that killed George Floyd only got arrested, and then he was released. So what happened to him made people realize that they should ban chokeholds. So the Minneapolis Police Department banned them. And another example of somebody who died because of police brutality is Brianna Taylor. Now, people have been trying to make her name known because, as we know, she got killed by when officers barged in her house while she was sleeping without a warrant. And so people are trying to get the police officers who killed her, justice. And after many protests and petitions, Louisville made the anonymous decision to ban no-knock warrants. Thank you.
Comparisons to other countries. Cops in Norway requires 3 years of training, and people died killed ever since 2002. Cops in Finland requires 2 years of training. 7 people died since 2000. Cops in Iceland requires 2 years of training. 1 person killed since ever. Cops in the United States requires 21 weeks of training, and 8,000 people killed since 2001. These various countries hold a principle on how more training can be very effective. Formulating police proposals. All states are required to have a distinction training, longer extensive training for police officers, at least 12 or more months, longer firearm training, and have supervision on rookie officers on the job. Evaluating the effectiveness. These police will not only affect the police, but it would also affect the people as well. There has been many reported incidents where the de-escalation techniques that some officers were taught actually help diffuse potential dangerous situations. The Dallas Police Department is a perfect example. They started to use de-escalation techniques, and they have definitely helped. 2009, the department received 147 exclusive force complaints and made 74,000 arrests. Within 3 years, arrests were down to 61,000, and within 5 years, that's it. You see over there, it shows you how this outcome is evaluated. Thank you for listening, and next slide is expectations information.
Okay, thank you so much, Group 3. Now we'll go to our final presentation for the day, and that will be by Group 5.
Hello, we are the Community Changers, and we will be talking to you about hazard pay. Hazard pay is additional pay for performing hazardous duties or work involving physical hardship, such as the nurses that are working during this coronavirus pandemic. According to the Balanced Careers, in all of America's 243 years of being a nation, there is no law requiring employers to pay hazard pay. For example, private hospitals are refusing to pay their employees because they are not supported by the government. Thousands of medical workers and staff have devoted their lives to helping others during this horrific time, and thousands of the same workers have had their salaries sliced in two, been cut off entirely, caught the coronavirus, have died altogether. This is an example of why hazard pay needs to be implemented and showing the hardships that people in the medical field face daily.
Today can you hear me? Can you hear me?
Yes, we can.
Okay, so today we'll be talking about disrespectful boundaries. We'll talk about the racial, ethnic, and gender challenges in the medical field. Then we'll talk about equipment breach, which is why medical workers around the country are not getting the right equipment needed. We will be talking about affected nurses and doctors. How many medical workers are catching coronavirus? And then we'll talk about hospitals being cut off, why hospitals are losing money or having to shut down entirely.
Healthcare workers are overlooked and underpaid. There are currently 18 million workers risking their lives and have only been appreciated. They have not been compensated and we need to continue to fight for their rights. Majority of these healthcare workers are made up of women, with 91% of that population being made up of 25% women of color. There are 10% African American and 10% Asian and 5% Hispanic. A nurse states that she's been working in the field for 30-something years and has only received about minimum wage. These are all examples of the challenges medical field workers are facing just because of their race, ethnicity, and gender.
Equipment breach. Public hospitals are being provided 27 PPE kits, which is a personal protective equipment. It is specialized clothing or equipment worn by doctors, nurses, and paramedics. PPE acts as a barrier and prevents the healthcare worker from coming in contact with an infection agent or fluid that might contain an infectious agent. This was used during Ebola accident in the 2012-2011 years. While private hospitals are being provided 4,000 PPE kits, we have public hospitals that are being provided 20,000 PPE kits. And that may seem pretty fair to you who are not being provided the equipment that they need. If health agencies are advocating the lack of equipment in hospital, it should be the government job to provide better equipment for its employees rather than denying their responsibilities. According to NYT, doctors at Barnes-Jewish Hospital in St. Louis are performing invasive procedures on coronavirus patients with loose-fitting surgical masks rather than the right respiratory masks recommended by health agencies. And Trump has to say that the federal government's not supposed to be out there buying vast amounts of items and shipping. You know we're not a shipping clerk. If he's not a shipping clerk and we don't have what we need, where are we supposed to get where we need at the time that we need it? And in immigrant communities, women nurses have been buying N95 masks from each other and online. And these N95 masks can have at least 5 inside a pack and be about $60 to $80. Because the hospitals they work at are refusing to give them even though they have necessary materials.
There are currently about 60,000 healthcare workers who have been diagnosed with COVID-19 and 300 have died. In London, they are recognizing that the risk that these people are putting their lives in and are compensating them with about 70,000 euros. Around the globe, nurses and doctors are receiving raises and being compensated for their hard work. However, in the United States, doctors and nurses continue to receive cuts and put their lives at risk for little to no compensation. This shows the little appreciation that this country has for these people putting their lives at risk for us continuously. Even the president continues to allow healthcare workers to face reduced pay, and because of his actions, this is leading many healthcare workers to quit.
Hospitals cut off. Hospitals are losing billions of dollars every day, and that's due to the healthcare revenue cycle management that they use to make sure they get the money that they need. It begins when a patient makes his or her appointment to seek medical services and ends when all claims and patient payments have been collected. Patient volumes are low as of right now, and hospitals rely on patient volumes for the revenue that they get to cover the cost of the care that they provide.
No revenue, no care. Hospitals, in fact, recent estimates indicate that nearly 67% of U.S. hospitals are losing money. That's half of the hospitals in the entire U.S. The CARES Act fund, which was made just recently, provides $2 trillion in total to all the hospitals in America. It is to be cut equally between all of the hospitals. As you can see in the union contracts from 2010, 90 rural hospitals have shut their doors. By one estimate, hundreds of other hospitals are at the high risk of doing so during this pandemic. Union contracts have gone low because hospitals have been cut off, or they're going down, or they're not being able to open their doors. In the private insurance revenue, which is where hospitals get their money, 10% in the top 10, they're getting $44,000 per hospital bed. Top bottom are getting $24,000. Employees at Partners Healthcare, which is a private where they're getting their private insurance revenue, the largest healthcare system in Massachusetts, they were given an email by the CEO saying that they will not be receiving hazard pay. The company makes $2 to $6 million a year. This company is making a lot of money, but they're choosing not to give the people what they need. The money that the government provides students that is only able to work for the course of 1 to 3 months. For example, a rural hospital in Upper Michigan was at the course of being able in bankruptcy, they were provided $307,000 for hospitals at their positions. One hospital can be in bankruptcy, meaning they cannot spend a time on anything. One hospital can be close to bankruptcy and cannot afford anything on hazard pay. And one hospital could be as Partners Healthcare and could be acquisitive to not give a cent to its loyal staff.
Hazard pay provides a financial platform for all medical workers. During this pandemic, groceries and other necessities have become more expensive to meet with the small supply. With extra pay, they can meet those prices and provide for their families. Hospitals continue to cut off the salaries of these people, not realizing how it affects them and the people around them.
Though they are less visible than nurses, doctors and other healthcare professionals, cleaners, security officers, and other service workers have been also risking their life to go to work throughout this pandemic, but with lower pay and less access to protective equipment, according to CNBC. Not everybody in America has to take loans or quit to take unemployment benefits. We need to not just appreciate but give back.
Because of the risk that these people continue to put their lives in, they need to be compensated and appreciated in this country. The only way this can happen is if hazard pay is implemented throughout the country so that we can appreciate the people risking their lives to save us. Thank you. I'm sorry.
Thanks so much for that great presentation. And now that concludes our presentations for the day. We'll have our judges go to a breakout room, and they'll have about 5 minutes to select.
Learn a lot about public policy and even venture off into new things that we hadn't heard before. I think it's been really effective in helping us learn the importance of research and importance of everything going on in the world right now. And I just thank McCoy and Jeffrey for giving us the chance and opportunity to be in this.
Okay, great. Thank you, Sally. And so I'm going to give opportunity for all the judges, and I can start with Stephanie. Anything you want to, final words you want to put across, maybe, Stephanie?
Yeah. I think all the groups did a great job of telling us about different social issues and different policy recommendations. Yeah. Okay. And the ones that stood out were the ones who really made it personal, and they were just giving us their ideas and not just specifically reading off the slides. And so I think that's really good presentations and helps us to stay more engaged. And I think that all the groups did a great job, and I encourage you to keep on learning more about politics and staying involved.
Thank you, Stephanie. Grace Mary?
Congratulations to all the groups.
You guys did a really amazing job, and I think you guys covered topics that some of us didn't even learn about till college. So that's amazing that you guys are learning this early on. And definitely keep pursuing that knowledge. And as far as feedback, I think as you start to advance further in your educational career, just one, try to put the citations, even if it's at the bottom, or include like an according to before stating the fact. That's really good to keep you accountable, as well as making sure that you're not reading like too much off the slides and you're including your own voice. But overall, it was a pretty good presentation.
Great. We got Dr. Nihal. Is Dr. Nihal still there? Maybe we can have McCoy.
Okay, first of all, I want to thank everybody for participating in the program. And I think you guys did a really good job. And it doesn't matter if you win or you didn't. It's just about what you learn in the classroom and how you apply it in the real world. So I want to thank you guys, and you guys did really good. I also want to thank Mr. Geoffrey for giving me the opportunity, and I really appreciate that. Thank you. I appreciate. Thank you for all the judges as well.
Good. And then we're gonna have Udani, and we'll also ask you to give some final thoughts.
Sure. So first of all, Jeff, thank you so much for allowing me to be here. I love that you have created this venue for students and for young people to talk about policy. Like, as a director of a public policy administration program for graduate students, like this is amazing and also energizing. All the projects here are very timely, and I really appreciated everyone's hard work in documenting some really concerning and violent times and proposing action steps in addressing these structural, racist, unequitable policies in our country. And so I was really impressed, actually, across the board, that you knew of the trap of devolving policy decisions to the local level. This is something that many of my graduate students, right, do not know. They still have this sort of like naive view of letting local municipalities or local states decide on decisions. So I really want to tip my hat and give kudos to those policy decisions of federalizing and equalizing these changes. So bravo. I really love the personal connections, what Stephanie said. Those are the projects that really stuck out to me. The ones that weren't just, regurgitating other people's research. I love the presentations that inserted your own voices and your own local knowledge and expertise, and also connections to your families and loved ones. I think that speaks volumes. So I want to make sure that you don't shy away from that. I feel like in policy proposals, that's what really energizes your audience, is that connection, like what motivates you to take up these issues. And so I think, if anything, to echo and ditto and piggyback on other people's suggestions, bullet points on your presentations really help. I think saving all the beautiful language and descriptions in narrative form is helpful, but having just a succinct message on your slides definitely help. And then just thinking, after your team gets done with your presentation, if you could just determine sort of like 3 takeaways that your audience want, that you want your audience to walk away with, and think about what those 3 things are, and then revise and build your presentation to emphasize those 3 things that you want your audience to take away from. I think those are really impressionable when you all start talking to legislators and decision makers, is to really fine-tune your message. But you are well on your way. Like I said, you're in a better situation than many of my graduate students and doctoral students. So I hope that you all stick with it, and I hope that I'm an avid observer of your progression. And please know that I'm here to support you in however I can. So just let me know. So anyways, I'm done.
Thank you so much. Thank you so much. I appreciate your input, and also also, I mean, like I said, okay, you really have added a lot of input into the discussion today. Is Dr. Nihal back? Yeah, wanted to ask if you want to say you have some few remarks to the.
I'm here. I think we're all getting some number alerts. So, yeah. Hi, I just want to echo what everybody has already said. I mean, the presentations were great. The topics are very timely. And I also want to echo that idea of the policy being at the federal level. I think most of you are aware of the hot mess we are in with COVID, and part of that is this lack of national policy at the national level and leadership at the national level. So everybody is left to fend for themselves, and so we don't have clear guidelines. You see CDC being told to do this, do that, and all that. So if we have universal federal policies, I think we would have better direction. And so, and all of you seem to understand that important aspect, and that's really, really great. And I'll just plug in, everybody wear your masks, please.
That is true. That is true. We all need to take our own precautions. The national government may not be able to tell you everything, but you don't need you don't need any better way to put it. We don't have any better way to put it, but take your own precautions to be able to use your. And I think also, like I said, even talking to people and educating people, other people, like you can do the video, you can do anything. That's another way of actually changing, participating in anything that will help us even to stay better. But I think other than that, do anybody else has something to say before we end the call? Amukoya, you want to say something, final remarks?
I think everyone did well, and you guys have inspired me to get more involved in the community. And I also want to thank you guys for being in the program. And I want you guys to not to stop and to continue and getting involved in the community and pursue your dreams. So thank you, Mr. Jeffrey, for the opportunity, and thank you, Sally. Thank you, Dr. Udani, for being in the program. It really meant a lot for me, and for having a professor from the school that I'm going to. So it really means a lot, and thank you.
Great. Thank you, everyone. Anybody with something that you want to say before we close it?
Oh, I have something.
Yes, Sally.
I just wanted to say thank you to everybody for joining, and good job to everybody. And one of the advice that I would say is try not to just have the information on the slides now. So use the information that you've learned in class to apply to your real life. So try to educate more people about this awareness of this policy, if you want to reach out to your local government and see changes that you can make. Don't think you're too young to, don't wait until later to start. You can start as young as you are now. Then we also have an announcement. We have another program starting next week, and the program will be on personal development, and we'll be sending out a link, and we'll encourage everybody who was in this program to participate in it, and also tell you a high school. So it'll be from 8th grade to 12th grade, and the program will be Mondays and Tuesdays from 12 to around 1 o'clock. And for the program, we'll cover things like goal settings, applying for scholarships, applying for college, finding resources, just learning about the whole application process, and also talking about like mental health, personal development, and all that. So we encourage everybody to join us, and the program will start on Monday, and I'll send out all the details out.
Great. Yeah. Thank you so much. And I think we cannot end this call without thanking Sally for the great work she's done all through coordinating all this, reaching out even to speakers, and even reminding people whenever we had meetings, events, and all that. And also Rispa, who is not with us today. I think she did very well communicating also to the attendants. And I think she's back?
Yeah.
She's in the audience?
Yeah, she can hear you.
Okay, good. Thank you, Sarista, and we appreciate you for the great work you've done. Like I said, tomorrow at 6 p.m., we'll meet at the church, and we will do now the practical part of it. We did the theory, so tomorrow we're going to do the practical part of it, where we'll go out and make an impact in the community. So at 6 p.m., I think Richard. 6 p.m. at the church. So I see Richard. Richard. I think he's just joining, but just wanted to say thank you for joining. But we are ending the discussion today. Like Arinola suggested, I think we would hear from you how we can be able to have a conversation on different discussion, so that we can build that communication skills and public speaking skills. Otherwise, thank you so much. Keep up with the good work. Don't take a break. Keep up working hard. And thank you, Dr. Andriani. Thank you, Dr. Nihal, Rosemary, and all those and Mkoy for the good job. Thank you, everybody. Bye-bye.
Bye, everyone.
Bye.
Thank you. Take care.
All right, take care.
Bye.